Hi, Mary.
Hi there. How are you?
Good. Good. It's kind of crazy today because it's Giving Tuesday and the kickoff of the Good Giving Challenge. So
yes, I know. I saw that when I got the alert at like 9 a.m. I was like, wait, am I supposed to be on at 9? Oh no, that's not.
Awesome. There's a bunch of people in here already. I think. I'm not sure we're waiting on anyone. So I will go ahead and kick us off since it's already noon. Thanks everyone for joining us today. This is going to be a 1-hour training on risk factors and signs of pediatric abuse, and it's led by Mary Wethington. If you're a CASA of Lexington volunteer, your attendance at this training is automatically counted by me and you will receive CEU credit. You do not need to fill out the online CEU credit form. If you are not a CASA of Lexington volunteer and you need proof of attendance, you will receive an email following this training that does confirm your attendance, and that only goes out to people who actually joined the meeting and attended. The attendance email will also include a link to the slides from this presentation and a link to our CEU review form. We'd love for you to take 30 seconds and fill out that form. It helps ensure that we're providing useful trainings, and it lets you suggest training topics that you'd like to see covered. Some more CEUs that are coming up that we're offering. We have 2 more coming up this year. December 14th at 5:30 here at the CASA of Lexington office is on the naloxone training and distribution. That's a half-hour training where you learn how to administer naloxone if someone's having an overdose from an opioid. And then 2 days later on December 16th from 6 to 7, there's a chair yoga self-care session, which will be both here at the office and available virtually. And more information about those trainings is available on our website, casaoflexington.org. Without any more delay, I'll let Mary take over and I will make sure that everyone that you can share your screen. Let me know if you can't. Yep.
All right, can everyone see that?
Looks good.
Okay. First, I just wanted to say thank you to CASA. I have had the pleasure for the last 3 months to spend some time within the CASA office, as well as spend some time in area courtrooms, learning about more about what CASA does. I am a doctoral student at the University of Kentucky College of Nursing, and this is one of our goals and missions of all DNP prepared nurses is to have some community outreach and just, learn more about the community. And I got lucky to be matched with CASA. So thanks again for all of you and what you do, both in the office and those volunteering to help those children out there. I, as a pediatric nurse, appreciate you. And with that, just a little bit of background about myself. I have been a nurse for the last 26 years, and the last 11 years I have spent in the pediatric emergency department at UK. With that, that is often the entry point into our system of abuse. Not only are they referred sometimes with suspicion of abuse, but often we find it when they're just coming in for common complaints. And that's sort of my mission of this talk is sometimes you're the one that may see it, not only in your child you may be assigned to, but just in your community, your neighbor, somebody you see at the store, something you just see. And it's all of us to advocate for the children and be that person that speaks for them when they can't speak for themselves. So here's just my objectives for this talk. So we're first going to have to talk about the incident and prevalence in Kentucky. We're going to identify different types of maltreatment, describe common causes and characteristics associated with those child maltreatment. And we're also going to look at some cultural considerations. We need to look at that because it's important that some things appear to be abuse or maltreatment to us, but really it is a cultural practice that they are doing, and it's actually in their eyes the best interest of the child. So we need to look at that as well. And then just like I said, discuss ways to identify and intervene in maltreatment. So first we'll start with the definition of maltreatment, and it's defined by any recent act or failure to act on the part of a parent or caregiver that results in death, serious injury, emotional harm, sexual abuse, or exploitation, or an act or failure to act that presents an imminent risk or serious harm. So we need to look at our social determinants of child maltreatment. So unfortunately, Kentucky ranks #1 in child maltreatment within the United States. And a study done by Hunter and Flores back in just last year in 2020, child maltreatment causes a substantial number of injuries and death. Through the systematic review of literature, it was found that there are top risk factors associated with maltreatment. These are listed here, including poverty, severe housing problems, uninsured, whether or not they complete high school, and their access to healthcare. So you can see there on the left our national data compared to our state data. The one that surprised me was the one at the bottom was access to healthcare. So some would think that would not be a determinant of child maltreatment, but that is actually where many go as a resource. If they don't have a person they can count on to watch their children, care for their children, make sure they're up to date on immunizations, et cetera, things fall through the cracks. And like I said, often things are found on presentation for things not necessarily abuse. And if they don't see those providers on a regular basis, that is a problem. Another busy slide here. This is just, I think it's important just to look at our national data versus our state data when it comes to our populations. This is just a breakdown of our ethnic population in the United States versus Kentucky. And then on the right is our victims of child maltreatment. Now that one's a little bit different. The rate is per 1,000 children. So of course you see there that the youngest children are the most at risk. And then on the right there, you'll see the victims by race. I added this slide, although the study that I referred to earlier didn't mention these two as a national problem. It is definitely a problem in Kentucky. Any of you that have spent any time within CASA or watch the news, we know that alcohol and drug abuse are a big problem in our state. So the staggering statistics there on drug abuse, 29.4 versus our Kentucky statistic of 53.7. Again, my time spent in the emergency department, not only seeing what adults come in, but also what the children are exposed to with most often neglect because their parents are under the influence of alcohol or drugs. We also need to look at maltreatment risk factors within the child. There's many factors that lead to situations that can result in child maltreatment and that place the child at risk for abuse and the caregiver become abusive. Younger children, those with irritable temperament, excessively demanding children are often a victim of physical abuse than those without those characteristics. Children with chronic illnesses or disabilities are often, they place a higher emotional, physical, economic, and social demands on their families and can be higher risk for maltreatment. It's also important to look at what I listed as long-awaited children. Many children that are born after years and years of infertility treatment, born to older parents, it's often a shock to those parents how difficult it is to parent, and after they have been without children for so long, those children are often at risk as well. And then, of course, parents with limited social and community support and lacked respite care or a break in childcare responsibilities can increase their risk of abuse or neglect. So child maltreatment recognition can be difficult. There are over 3 million referrals to Child Protective Services annually. Some of those, which I'll talk about later, just because you're reported, because you have suspicion doesn't necessarily mean the maltreatment has been found, but it's important to at least refer to them and let the experts decide if your concern was, a valid concern or not. Children under 1 are the most vulnerable, and 75% of all abuse cases are under the age of 4. And this is, of course, due to their vulnerability, due to their dependency on the parent, their small size, and their inability to defend themselves. So there are 5 main types of child maltreatment that I listed here: neglect, emotional abuse, physical abuse, sexual abuse, and I listed here, just of interest, a very rare maltreatment called Munchausen syndrome by proxy. So first, neglect, which is characterized by failure to provide the child's basic needs. The caregiver may neglect physical, emotional, or educational needs. Neglect is the most common cause or a form of abuse, comprising of over 70% of all reported cases. Physical neglect includes abandonment, inadequate supervision, or refusal and delay of seeking health care. Physical neglect can also be expulsion of the child from the home. Emotional neglect includes inattention to the child's needs for affection, refusal or failure to provide psychological care, and spousal abuse in the presence of the child. Educational neglect includes failure to enroll a child in school, allowing for chronic absenteeism, and additional educational neglect includes failure to enroll a child in special needs or special education programs. Emotional abuse is the next one. It is the deliberate attempt to destroy the self-esteem or competence of the child. The difference from emotional neglect is because it's intentional. Psychological maltreatment occurs when a child is told he or she is worthless, flawed, unloved, or unwanted. There are often no physical signs of this type of abuse, but it's important to remember that all forms of child maltreatment do include some level of emotional or psychological abuse. Physical abuse is the deliberate infliction of physical injury on the child and is usually at the hand of the child's caregiver. One or more body systems may be involved, and because it's often ongoing, there's usually both evidence of acute or chronic injuries. Those of you that are familiar with healthcare know that all of us love to have little acronyms, and one of the acronyms that we use to identify physical abuse is 10-4. I have this short little video that does a great job of explaining it here. If it will work, let's see.
Nothing's coming up for us yet.
Oh, I'm sorry. Let me see. I think it's because I have to share a new.
You may have to stop sharing the PowerPoint and share the YouTube video.
I bet that's what it is.
Oh, now we can see it.
Okay, sorry about that. You see it now?
Yes, but we're not getting any sound.
Oh, no.
So what you probably need to do is stop sharing and then reshare. And when you share, there's a little checkbox you can check that says share my computer's audio as well.
Oh, I see it now. Okay. Sorry about that. Technology gets me every time. Okay, let's try it one more time.
Kids are kids.
Yep, good.
Sometimes they play in ways that result in minor injuries, often found on bony areas of the body, like knees, shins, elbows, and foreheads. However, there are other types of bruises that should be a red flag for possible abuse. An easy-to-remember acronym is 10-4, where, for children 4 years of age or younger, bruising in these areas are cause for concern and need to be reported. T stands for torso, E stands for ears, N stands for neck, or any bruising anywhere if the baby is not yet pulling up or taking steps. Taking action when you see bruising can be critical to the child's safety. Document what you see and what you hear, then make the report by calling 1-877-KY-SAFE-1. Professionals with appropriate training will handle the investigation. Child safety is an adult's responsibility. All Kentuckians are mandated reporters of child abuse and neglect. You can be the face that ends child abuse. Learn more at faceItabuse.org.
Writing's not that easy, but Grammarly can help. This sentence is grammatically correct, but it's wordy and hard to read. It undermines the writer's message, and the word choice is bland. Grammarly's cutting-edge technology helps you craft compelling, understandable writing that makes an impact.
This was supposed to be so easy for me to do. Let's see. Okay, can you guys see that?
Yep, we're back.
Okay, I'm back. Sorry about that. All right, so the next one is form of abuse is sexual abuse. Sexual abuse involves the engagement of child in sexual activities that the child cannot comprehend, developing unprepared for, in which the child cannot give informed consent, and violates all social and legal taboos. Sexual abuse can be actual or attempted oral, vaginal, or anal penetration. It includes various types, including digital manipulation, fondling, intercourse, exhibitionism, and pornography. So these slides are from the organization called RAIN. They describe in fiscal year 2016, Child Protective Services substantiated or found strong evidence to indicate that 57,000 children were victims of sexual abuse. 1 in 9 girls and 1 in 53 boys under the age of 18 will experience sexual abuse or assault at the hands of an adult. 82% of all victims under 18 are female. Females 16 to 19 are 4 times more likely than the general population to be victims of rape, attempted rape, or sexual assault. And last, like I said, is extremely rare, called Munchausen syndrome by proxy. And it's a form of child maltreatment where the abuser, who is almost always the caregiver, exaggerates or induces symptoms of illness to the child. Munchausen by proxy can be motivated by the need to assume the sick role by proxy or to gain attention as a long-suffering caregiver of a chronically ill child. It's often the mother who has some exposure to a healthcare environment and is highly involved in the child's care and may have a history of finding new specialists in different hospitals. Like I said, this is extremely rare, but I just thought I'd mention it. It's also important to mention some conditions that are often mistaken for child maltreatment. I have a picture up there on the top left. This is one of the most common things that people think as bruising. That's called Mongolian spots. And there's also some birthmarks that can resemble bruising. It's often found on children with darker skin. And like I said, can mimic bruising, but it's definitely not bruising. Impetigo, which is the picture there on the bottom left, can often imitate cigarette burns because they're circular in nature, but this is a bacterial infection and not a case of abuse. Another reason for excessive bruising can be an indicator of clotting disorders. And there's also some infections like fifth disease that looks like the child's cheeks have been slapped. And then there's also a rare disorder, a brittle bone disorder called osteogenesis imperfecta, that young infants' bones can break more easily. Some signs of maltreatment on the left are some indicators with the child. You may see extremes in behavior. They're wary of contact, especially with strangers. They're clingy. They may have a flat affect. Another thing is they may have no response to a painful event. You may see them playing and they fall, and any other child would cry or in response to that pain, and they may not have any response. You may see sexualized behavior in cases of sexual abuse. Often there's regressive behavior in all forms of abuse, and they may have an unkept appearance in cases of neglect. On the right, there's some caregiver indicators. You may hear the parent have an inappropriate response to the severity of what's going on with their child. They may have no explanation or a changing explanation for what's, you may have a concern if there's bruising or whatever, they may change their story. And then often there's a delay in seeking treatment or no treatment at all. You may also see tension between caregivers or hostility as well. So some cultural and religious health practices can be mistaken for child maltreatment, and we need to be aware of the differences. There's a variance in presentation in these practices, and we must balance the rights of the caregiver or the parent with those of the child. These health practices are based on heritage and religion of the family as well as the caregiver. Generally, these practices are well intended and attempts to relieve pain and suffering in the way that culture has taught them to do. We need to explain that the caregivers, these type of remedies can be considered harmful in the United States, and you may want to consult with their folk healer or somebody else in an alternate treatment. The first one I'm going to talk about is cupping. And you'll notice I put a picture there on the right. This actually has become very popular in the United States. The first time I really saw it out was in the Olympics. And swimmers often, probably because you can see them, will do it. It's a practice used in Asia, Europe, Russia, and the Middle East to draw out poison or evil elements. It's commonly used to treat headaches or respiratory ailments, or in the case of these swimmers, I think they use it for muscle tension. So how they do it is a heated cup containing steam is placed on the skin, and then it creates that sort of bruising-like appearance on the skin. And as the air cools, the vacuum is formed, and that's how that bruise happens. And then the bottom, the left there is a thing called coining, which is a Vietnamese practice that's used to release toxins that may cause illness. It's common use for respiratory ailments, and it's performed by repeatedly stroking a coin on the skin, lengthwise onto oiled skin, sorry. And this process will develop these welts like you see on this picture here. There's some other traditional remedies that we should be aware of as well. Burning in Southwest Asia is a practice where small areas of skin are burned. It's commonly used to treat pain, cough, diarrhea, failure to thrive, and temper tantrums. Moxibustion is a Southeast Asian practice in which a stick of burning mugwort, incense, or yarn is placed over the affected area of the body. This practice may produce lesions that resemble cigarette burns, and usually a pattern of 4, 6, or 8 in a pyramid formation. Topical garlic treatments is a Yemenite Jewish practice where crushed garlic is applied to the wrists or ankles and often used to treat infectious diseases. This can result in blisters and garlic burns. And there's other traditional remedies that contain lead. These are ingestion, and these include, pardon my pronunciation, Greta or Azaran, which is in the Mexican culture, Payloon, which is a Southeast Asian culture, and Surma, which is an Indian culture. So I think, I don't know if any of you are aware of this now famous TikTok thing that was promoted. It actually started in Canada, and my children are always wanting me to watch TikTok videos, which I refuse, but I do want to share this because this is one good thing that has come out of TikTok. And I'm just going to share it and then we'll talk about it. Hopefully I can share it easier this time.
Save with Liberty Mutual. Okay, who sat at my desk?
Stop scrolling. Did you know that this is the signal for help?
A simple gesture viral on social media platform TikTok.
Open hand, thumb across your palm, and close your 4 fingers into a fist.
Now being credited for a remarkable rescue in Kentucky.
He observed a young girl in a passenger car that seemed to be in distress and was giving the TikTok signal that she needed help. We didn't know what that meant.
61-year-old James Herbert Brick charged with unlawfully imprisoning a 16-year-old girl. She was reported missing by her parents last week, but wasn't found until 2 days later in a different state when a passing driver noticed she was giving that signal for help and called 911.
We feel like we saved the young girl's life.
What did you think when you found out that it was a hand signal created here in Canada that helped rescue this girl there in your county?
I think it's wonderful because obviously had this not happened as it did, then that vehicle would have traveled right on through our county and no telling where it would have wound up at.
Can you share that banana bread recipe?
The Canadian Women's Foundation developed the sign as a silent alert for women stuck at home with their abusers.
I know your mom is a great baker, so I should be good.
A sign, really important for people to know, but it's much more important, I think, for those of us around people who are experiencing abuse to know how to respond to it and proactively recognize it.
The effort was spurred by the pandemic-fueled increase in domestic violence.
No wonder that when people saw this, they said, let me share this, let me be a part of this conversation. Because it is something that we're facing every single day.
That harsh reality fueled the signal's spread. Its positive impact after this unlikely Kentucky rescue now clear. Ellen Morrow, CBC News, Toronto.
So yeah, like I said, I don't know if any of you were aware of that, but it's just, and there's things like this that come out all the time. So it's just important for us to just be aware of our surroundings and what's going on. For those of you, I'm sure you're probably aware, but this, again, I'm just listing the number. If there's any suspicion of abuse, it's important for all of us as Kentuckians, as mandated reporters, to report our concern for abuse or neglect or dependency. These are just my references. Also, I wanted to thank the Emergency Nurses Association. Some of the pictures that I had, I used from a prior presentation with them. And with that, that's my email if you guys ever need to get a hold of me. And that is all I have.
Does anyone have any questions or thoughts on that presentation? I had not heard of that hand sign before. I'm also not on TikTok, so.
I'm not either, but like I said, at least something good has come out of TikTok, I can say.
I did not realize that all Kentucky and all adults were mandated reporters. So that's good information as well for people to feel like they have that ability to do that.
Yeah, I was actually unaware of that as well. I knew as healthcare providers, I was a mandated reporter, but when I did research for this presentation, that's where I learned that. So it's good to know. We definitely need to get the word out there that all of us out there, if we see it, we need to report it.
I think you went through some traditional treatment methods as well that I hadn't seen before. And I think some of those, at least in my mind, at least, would those still be considered abuse, or at least worth looking into if it's happening to a child, even if it's traditional?
Absolutely, yes. It definitely has to be looked into. And often it's just an education issue. Like I said, these parents or caregivers are well-meaning. This is just the traditions they've been taught. So often we just address it with them and talk about alternates, and they can even talk to their community as well of alternate treatments that until that child is able to consent to these procedures. If they're 17 years old and they're a swimmer and they've heard about cupping and want to try it, I think that's different than doing it on a 3-year-old.
You talked about bruising for children under 4 years old. Are there any signs or symptoms that we need to be looking for in our older youth or even children who are older than 4? It's probably rare, but are there that we would see like the insides of legs and thighs, but inside of arms, if we see anything like that, is that a cause for concern or?
Absolutely. I didn't go much into it because I've tried to kind of balance my role as a nurse versus just, out in the community. But if there's patterned bruising, often if there is a handprint, you will see sort of 3 lines that mimic the in-between part of your hand. That is exactly what you're describing. You'll often see that on thighs, arms, or grab marks. So those are definitely concerned as well in those children over 4. It's important just to look at the pattern. Some kids are just rough and tumble and they'll have different stages of bruising and healing all the time, but it's really where they're located and what it looks like.
When you mentioned the physical abuse, your slide said that it would most often involve at least 2 body systems. What do you mean by that?
So often, like if you'll see bruising on an ear, and then you might see bruising somewhere else on the body. Ear bruising is really common, especially in small children with head trauma. And then it's very common to see bruising in other areas because they may have had to grab the child. And I hate to say it, but often the child are actually slammed against something else. And that's how you'll see the secondary body system involved. So you'll see grab marks and then you'll see like a head injury together.
So what usually, when you're seeing these children brought into like the ER or to a doctor's office by their caregiver, what is prompting them to bring them in? I mean, obviously they would not want it to be found out that there was this abuse. So what is I don't know if it's an excuse or what brings them actually into a physician's office?
So I guess I should be thankful of how naive the population may think we are and how often we see it. And parents will bring their child in for their cold or really minor complaint. And we are advised as healthcare providers with children, even if they come in for a runny nose, we do a full skin assessment. And it seems strange to parents, but we just kind of, talk it up like, oh, we're just going to check everything out, see if there's any rashes. And then that's when we'll often see things. And then we'll talk more about it. And they often do not have a good story or don't have a story that matches the injuries. And that's when we begin our investigation. But yes, thank goodness they still come in for these minor ailments that we then find out the bruising. And often these parents that are bringing their child in, they are not the abusers. It may be a spouse, it can be a boyfriend, it can be a daycare worker. And so sometimes it is news to them as well, if they have not, seen the abuse, especially in daycare situations. So we're just thankful they still come in.
Are there signs of abuse that are common to older children? I know the rates were lower for how often it happens, but I didn't know if there were different signs that usually show up when older children are being abused.
So luckily, it's really if they are willing to talk to us, and really the sign is if the stories change. If we can separate the parent or the caregiver from the child and talk to them about what's going on, if we see things, because often, you'll see regressive behavioral, they become quiet, withdrawn, and you've just got to get it out of them and talk to them. That's the one advantage we have to older kids, is if we can just give them that trusting environment that they can talk to us.
Are there particular ways you have to go about getting them separated from their caregiver to get that private moment with them?
Well, luckily, especially with teenagers, that's a common practice just for their privacy for all matters, not even abuse. So that is how we present it initially, is just saying, hey, we just try to do this for all teenagers. I know you want to know everything that's going on with your child, but sometimes they'll tell us stuff they don't tell you. So if you don't mind to step out for a second, we're just going to do a quick history, talk about this, and then we'll have you come back in. And 99% of the time, the parents are agreeable and don't really put up an argument about it. We also have other things that we do both in our adult population and in the pediatric ER. So if children are old enough to give urine samples, we almost collect urine on everybody. Just so you're aware of one other thing we do. So we have these little red dots, sticker dots that are kept in our bathrooms. And there's a sign up there that says, if you are have concern of abuse with the person you are with, place the sticker on the bottom of your urine cup and we'll investigate. And so all they do is put that red sticker underneath. When we collect the urine, we look underneath and see if there's a red sticker. And if there is, then we proceed.
How effective is that? That's a great idea.
Yeah, we have caught several occasions, especially of sexual abuse that way. So we originally just had it in our adult emergency department, but we have expanded it to our pediatric ER as well.
How often do you wind up investigating potential signs of abuse and it winds up being actual abuse versus the signs were there, but it turns out not to be abuse?
So Kara's on here. I've talked to her quite a bit about this. The difficult thing about me being an emergency department nurse is I don't see the outcomes. I don't see what happens to these children after the investigation starts. So often DCBS will come on site and do everything they need to do. We will often admit children for a safe placement to the children's hospital until everything can be figured out, or they're placed in emergency custody. But that's the last I hear of it. I never know the outcomes of what happens with all of this. So that's the difficult part of my job for sure.
Anyone else have some questions or any other thoughts on what was noteworthy to you during that presentation? All right. Thank you so much, Mary, for leading this training. We really appreciate it. And everyone else I hope everyone has a great day.
Thank you.
Thanks a lot.
Thank you. It's great.
Thank you.
Thank you.